constitutional rights of South Africans to emergency medical treatment has been abused. The panel was set up by the Competition Commission to evaluate the state of competition and the cost in the private health sector.
Lamenting the high cost of private health and highlighting the fact that government inherited a fragmented system after 1994. Motsoaledi says a two-tier system in South Africa favours the wealthy at the expense of the poor. The minister insists that the private sector does not understand the importance of making healthcare available to all citizens.
They seem to be believing that the world consists of those 16% of the population that are able to take care of. The other 84% does not seem to be existing. And I don't know where we are going to throw them to, because they are very much citizens of this country.
Earlier, representatives of private hospital group Netcare made their submissions. They say they pay 14 times more for drugs and surgical equipment in South Africa than they do in neighbouring countries. The group says part of the problem contributing to high healthcare costs is the critical shortage of doctors and nurses. Similar hearings have been held in Gauteng over the past 2 weeks.
Upon completion, then the inquiry will produce a report with its findings. A provisional report will be issued that will be shared with stakeholders. We will also then issue out recommendations that will go to the relevant stakeholders depending on what the recommendations are.
Final recommendations are expected by December. Vanessa Puna, SABC News, Cape Town.